And let me start with a very, very simple question. Cancer is kind of an enigma still to all of us. ICMR's recent survey tells us that it will go to almost, the cancer load will go to around close to 30 million by 2025 from around 27 million in 2021. What are the reasons of this rise and such a big rise? And what can we do as individuals and as a society to at least ensure that the rise is curbed?
So I completely agree with you that as we go along, the cancer burden is going to rise. Now, as the cancer burden is going to rise, we have to do something and we have to devise strategies, because it is not only a health issue, it has become a financial issue. Why? Because if you look at the government's funding expenditure, then lot of money goes into cancer care, and therefore most of the budget, if it is going for cancer care, we have to also be conscious that as our population is going to age and our cancer burden is going to rise, there is going to be an exponential increase on exchequer burden on cancer. So we have to classify what kind of cancer is rising and what cancer can be addressed. When we classify that, perhaps we will be able to find a good strategy. Now, there are two types of cancer. Those cancers which are suitable for early detection and prevention, and there are cancers which are not suitable for early detection and prevention. For example, like brain cancer, blood cancer, bone cancer, cancer of pancreas. There are many cancers for which we do not have early detection programs or early detection strategy. But at the same time, for three cancers which are very, very common, oral cancer, breast cancer and cervical cancer, which are the lead cancers in men and women, we have strategies for early detection. And therefore, the government of India has embarked on an ambitious program of early detection. But what is most important is prevention of cancer. Now, in India today, if 1 million new cancers are being diagnosed, 10 lakh new cancers are being diagnosed every year, nearly half or two-thirds, I would say, are lifestyle related. Lifestyle related means we are talking about the disease for which we are worried, but we ourselves are responsible for that. Now, when I say prevention, number one is tobacco, and Goa is one of the front runners which has done effective tobacco control program, be it chewing tobacco, be it smoking. But what has remained untouched is pan masala and areca nut, which are shown on the cinema hall, which is shown on the television, celebrity endorsement is there. The second etiological agent for not only cancer but non-communicable disease. See, 60% of the deaths currently are because of the non-communicable disease. Cancer is one of them. Heart disease, diabetes, chronic obstructive pulmonary disease, there are other, and stroke, these are the other non-communicable disease. Now, the second most important cause of non-communicable disease is alcohol. Now, in Goa, if I talk about alcohol, I may be thrown out of Goa maybe tomorrow, but
We'll
as a
tell
science,
you, don't tell us not to drink, just tell us how to drink it well.
yes.
In a regulated manner.
So, as a scientific person, as a researcher who sees cancer, I know that there is a safe level of alcohol. So, what our focus is that people should not indulge in unsafe form of alcohol, excessive alcohol. Therefore, there needs to be a policy on alcohol. The third is unhealthy food. Please understand, what is there in the plate of our children today is not decided by the grandmoms and moms. It is decided by what they see on the television. Most children prefer anything which is advertised. And therefore, obesity is going to be a big problem in days to come. And today, when I talk about tobacco, alcohol, in America, obesity is a bigger problem than tobacco and alcohol. And third most important thing is pollution. Now, pollution has two components. One is vehicular pollution and other is industrial pollution. Now, vehicular pollution, industrial pollution, for industry there are norms, but for vehicular pollution, which is very, very significant burden of air pollution, there are no norms. The reason is that public transports everywhere are failing, and therefore everybody is trying to buy the cars or use the personal transport. So, four things that I have told about a big problem, we are responsible for it and we can work on it.